We talked briefly last time, and I'm not going to go into this in great detail about why do this, but we all know that mental health consultation is becoming increasingly difficult for patients to access for many reasons. Part of it is the scarcity of mental health consultants in many parts of the country, and also the costs to families and the poor insurance coverage that often goes along with mental health consultation. So really the onus is increasingly on our shoulders to provide more and more of this kind of care in our offices, at least get the ball rolling, and everyone really needs to know what their resources are in their own communities. We know that statistically, almost 36% of patients that we see in a pediatric setting are going to have some sort of mental health concern. So this is a huge, huge problem, and something that we feel that we need to really get more comfort in terms of implementing help for families. So if you look in your folders, I put a template in there for conducting a behavioral interview. This is something I've been using for 25, 30 years. You'll also find several anxiety questionnaires in there, and Linda will be talking about anxiety, and you'll also find several depression questionnaires in there that Dr. Richter will talk about when she presents. But this is the behavioral interview. I just want to spend a few moments and just go over some of the facets of this. Questionnaires are always very helpful. I find that it's helpful to sit down and spend up to 60 to 90 minutes with families who present with problems. And I've used this as a template for many, many years and have kept on tweaking it over the years. And feel free to use it as is or modify it any way you would like, but it's something that I have found very helpful over the years in terms of working with families. I always like to start just by asking families what their major concerns are. Sometimes families will call us and say, I think my child has ADHD or my child's depressed, and I want to sit down and talk with you. But I always like to ask them when we start our session, what are the major concerns? What are your concerns as parents? If the child is a little bit older, school age or an adolescent, I usually include the kids in the conference, and we'll ask the kids what their concerns are, and also ask the families what the school's telling them, because that's really been helpful. And I like to open with just an open-ended question, and sometimes what happens is that the whole agenda changes by doing that, and what I thought they were coming in to talk to me about is really something quite different. So if we are too directed in our approach and start off with very finite questions, we may not get to really what the family's concerned about. So I like to just start off with, just tell me why you're here today. What are your major concerns? And if you look in the template, what we've listed out is just most of the very common kinds of concerns that are likely to come up, with a couple of kind of little guides and coded questions that you can ask to remember various facets of each problem and sort of just get a feel for where you think the problem lies. So is this child here for attentional problems? Are we dealing with distractibility, impulsivity, attentional issues? Is this oppositional behavior? Are there some acute stressors going on in the family that are important to know about? I like to ask if there's any signs of depression. Is the child just feeling very sad? Are we seeing other manifestations of depression? I like to ask about anxiety, because that's another common presentation. We want to know if the kids are having any generalized anxiety, separation issues, phobias, etc. Trying to get a sense. I see a lot of kids who come in with not necessarily global, developmental delay or autism, but a lot of kids present with more of a PDD kind of picture. So it's, I think, helpful to ask questions along those lines as well. I like to ask about temperament, which we talked about last time, and sensory processing. Is your child have difficulty with the way things feel? If you go out to a mall, do they fall apart because of the visual and auditory stimuli that are out there? So these are the kinds of things I just sort of like to get a feel for as I'm kind of going through the history. I'll ask about elimination disorders. Are we experiencing sleep problems, eating problems? Is there substance abuse? And is there anything else that I missed? But I think it's pretty comprehensive list if we go through that, and I usually kind of can hone in on what the major issues are. I also like to take a school history, what's been going on in terms of how is the child learning. Is there some underlying learning disabilities that we need to know about? Is this a child who's having academic problems, which can be signs of learning disability, can be signs of depression, can be a lot of other things. And I always like to see if they've had any prior evaluations. And who indeed had seen them in the past, what kinds of findings were, were there other psychometric testing that's been done, or educational evaluations, other therapists or counselors that have worked with the child. So that's very helpful to know as well, I think. And just like any history, this is modeled after any standard, medical history that we would take for any problem like abdominal pain or headaches. We want to know a little bit about past medical history, and particularly with behavioral problems, or if there's some developmental issues, we'd like to know, perinatal history, developmental milestones. Usually ask a couple of point questions about when did the child start to walk, speak, when did they start putting words together. I ask about toilet training, and then I like to review the medical history. In my office, the kids that I'm generally seeing in my office are patients that are already established in my office. So I don't need to delve into a lot of this in great detail. But if you're seeing a child for the first time, I think these are all important things to know about. And particularly I'd like to know if there's any other medical issues that might be tied into some of the behavioral problems that we're seeing. I like to ask for family history. And this is always between family history and the next thing is social history. Even for families that I've been seeing for a long time, it's often very enlightening to sort of sit down with them. A lot of times they come in for their checkups, but we don't really get into a lot of the details about family history and social history. And it's often, or sometimes I've forgotten, what parents are doing for a living, et cetera. So it's very nice to have that information and sort of review it with them. But I like to know about the parental family medical history. I like to ask families, the parents, if they're having medical problems. I also like to know what level of education did they complete. Often we see kids with ADHD or school problems, and it's helpful, I think, to know if the family, parents, mother or father had similar issues when they were kids. I like to know about whether their siblings who are having issues as well, and are there other family mental health issues that are going on. So I like to know about who else in the family may have ADHD, who is depressed, who has anxiety. Is there other sort of more significant mood disorders in the family, substance abuse, etc. And all those little items are cued in on that template. It's important to know who does the child live with. And often I get information that I didn't know about. I may even find out that the parents have split up, and I didn't realize that until I sit down with them. What other stressors are going on in the family? Are the parents together? Are they experiencing financial problems, marital problems? How old are all the siblings? Are their grandparents involved? And I also like to know about peers. How does the child get along with other kids? I think it's really very important, particularly for making some of the diagnoses like ADHD. If kids are depressed, in their social withdrawal, I think that's important to know. So I think it's helpful to know if the kids have friends, how many, what do they do with their friends, and how old are the kids that they like to play with. And that's often very helpful. Like a lot of our ADHD kids, I have an 8-year-old who likes to play with 4-year-olds. That kind of gives me some information about, where this child is at emotionally and maturationally. And I ask the parents, does your child act like someone his age? Do you think he's acting more mature, less mature? I think that's nice information to have as well. And then in conclusion, I always like to sort of wrap up with strengths, because we just spent the whole hour generally talking about, what are all the things that are wrong with your child. But I really like to spend some time and get the family to talk a little bit, particularly if the child's sitting there. What are the things that are positive about your child? What does he do well? I think it's just really important to have some balance there. It's also very telling when I have a parent who says, who sort of hems and haws and can't think of anything that's positive about their child. It's often very sad to see that, but it's important, again, if they're so locked into crisis in their family and there's such negative tension, that the parent can't think of anything good about their child, it's really helpful for us to know in terms of how steeped in conflict is this family. I always like to ask the parents, what do they think's going on? Because I think that's very telling. And again, I'd say most of my parents are pretty on mark with their diagnostic abilities and pretty much to say, I think my child has ADHD, I think my child's depressed, they have anxiety, whatever. But sometimes they say something that's like so different from what I'm thinking, it's really important to know where they're coming from so that we can kind of meet in the middle somewhere. I always like to ask them if there's anything else that we didn't talk about, that they want to kind of kick in so that they're not hitting me with that information as they're walking out the door. And I like to talk to the family and the kids if I'm thinking that medication may be an issue, particularly for some of the kids with ADHD. What are their thoughts and concerns about medication? What have they heard? I have parents who tell me, yes, I don't want to leave here without a prescription. And I have parents who say, there's no way in hell I want a prescription for my child. I think medicine's horrible. But I really need to know where they're coming from before we can have a conversation. And then I like to spend a little bit of time going through what I sense is at least my working diagnosis at that point. Presumably, for some of our kids with ADHD, I've collected some of the questionnaires from the school at that point. And I have my own working sense of what's going on after reviewing the school data and talking with the parents. And now's a good time to at least kick around some tentative diagnoses. And then before families leave, I usually like to just sort of at least come up with a game plan. Even if we have a tentative diagnosis, I like to sort of have some idea of what I can give them to do that's tangible to take out with them, so we have a starting place. And that may include educational accommodations. Again, I've listed those in the template. But is this a child who needs a letter from me for a 504 accommodation plan in school? Do I think there's some psychosocial recommendations that I need to make that might include, referring to a mental health consultant? Is this a child who is going to require some psychoeducational testing? I like to think about the kids from a social point of view. Some of the kids that I see who have ADHD really do well if they are in a setting where they are around other peers. That might just simply be going to camp over the summer, or joining a team, or joining scouts, but just having some ability to practice social skills in a normal setting with other kids outside of school. For some kids, it may mean referring them on for a social skills group. So that's another area that we want to be thinking about. Medically, I'm thinking, is this a child that I think may need medication? And then we need to think about how, when are we going to talk again, follow up? Is this something that we can do by phone? Do we need to set up another appointment? And then miscellaneous recommendations might include giving them some lists of books to read. If the child has ADHD, I like to tell parents about CHAD and make sure that they at least look that organization up online, or attend some of their meetings. So I'd like to give them at least a few things, not overwhelm them, but a few things to kind of take out of the room. In terms of good screening resources, I have a list in your handout as well of some of the things that you can access online or purchase that I think are nice resources that are good to know about. So we talked last time about the pediatric symptom checklist. That's a nice tool that can be administered either before the family come in, or at the time of a visit, and gives a lot of information about, is there a problem that needs to be addressed. Are people familiar with the ADHD toolkit? Anybody using that? So the Academy of Pediatrics has a really nice toolkit that you can purchase that has lots of information in there about doing assessments, and it has all the Vanderbilt diagnostic screening tools, questionnaires, recommendations for families, and how to develop a working plan with a family. So if you see a lot of kids with ADHD, I think it's a really nice resource. GLAD PC, anybody familiar with that? So that you can access that online, and I have the information on your sheet. But this was also put together by a group, and it's basically a how-to for working kids up with depression. And it's a very nice tool that's online that you can access. has also questionnaires in it and lots of information about, how to make a diagnosis, how to evaluate kids, and lots of intervention strategies, and talks a little bit about medication. So it's just a nice resource that you can look up online and download if you're interested. Also, Massachusetts, they have a behavioral screening toolkit, and I have that on your sheet as well. And it has lots of nice tools in there that you can use if you want to do mental health screening in a pediatric primary care setting. You can the anxiety scales, the SCARED is the PDFs are downloadable, and if you are going to see kids with anxiety, it's a nice it's a nice questionnaire to have as well. The Academy of Pediatrics also recently put out a mental health toolkit. Has anyone purchased that or familiar with that? So it's another excellent resource that you can purchase from the Academy that has lots of links and very good information about working kids up for mental health problems and intervention strategies. There's also Bright Futures has a book that was put out, Mental Health Volume 1 and 2, that I think is a nice resource also if you're interested in pursuing some of this. Last time we talked about the DETECT, which is a screening tool, a template actually for thinking about kids with mental health problems that our committee published a few years ago. There's Chattis, and Barbara Howard's here to that can tell you more information about that. It's a software program that families can access online, and there's lots of a wealth of information in terms of, again, screening for kids with behavior problems, and also intervention strategies, and lots of information for people who want to just read about various kinds of problems, and she certainly can fill you in on that. There's also a new book that was published by the Academy of Pediatrics, which is the Guide to Learning Disabilities, by Larry Silver and his daughter, Dana Silver, who's a primary care pediatrician at Sinai Hospital in Baltimore, and has lots of good screening tools that are simple to implement if you're seeing kids with learning disabilities. And then finally, there's the Columbia Teen Screen that I have your links to as well for evaluating adolescents with depression. So there's a wealth of stuff online if you're interested in pursuing some of these things that you can easily access.